Joining me now on Skype to talk more about this is Dr. Gregory Popcak. He is director of CatholicCounselors.com. He is also the author of Unworried, A Life Without Anxiety. Thank you so much for joining us tonight, Doctor.
Thank you, Tracy.
I know healthcare professionals face a great deal of pressure on a daily basis, just under ordinary circumstances. How has the COVID-19 pandemic magnified those stresses?
Well, the long hours, the limited resources, and the uncertainty about how to treat this disease and how bad it's really going to be have, I think, ratcheted up the normal stress that most healthcare workers experience on a daily basis.
Do you think there's a reluctance on the part of doctors and nurses to admit the impact that this is having on them psychologically, or do you think they even realize the impact because they're so caught up in this moment of treating patients?
Yeah, I think healthcare workers tend to see themselves as healthcare givers, not healthcare receivers, unfortunately. And because of that, there does tend to be a fairly high rate of burnout and compassion fatigue in the industry in general. And burnout is when work loses its sense of meaning, right? And compassion fatigue is when we care so much that our own tank runs dry. And because healthcare workers tend to drive themselves to care for people so much, they tend not to notice when their own tank is running empty. And because of that, there's a greater risk for people to experience things like depression, anxiety disorders, and the like. And of course, there's also a bias, remarkably, in the healthcare industry against seeking mental health help because it's both seen as a personal weakness, and also state boards actually ask about mental health history on medical licensing exams. So there's a strong disincentive in the profession to seek proper care at the right time.
I know a recent study of healthcare workers in China found that many of them are reporting symptoms of depression and anxiety after treating COVID-19 patients in that country. Do you think there's a lesson there for us here in the United States?
Yeah, no question. I think that we should expect a similar experience for healthcare workers in this country. And it's a warning that the people who are on the front lines do need to, first of all, do what they can to take care of themselves, to create a sense of community within their own units, so that they're making sure to really look out for each other as well as looking out for their patients. It's going to be important to find ways to remind themselves about why they're doing this and why it's important. As I said, burnout is the result of work minus meaning. And whenever you're just driving yourself for 12, 14, 16 hours a day, you can start to feel like a cog rather than a care provider. And so reminding yourself of why you're doing what you're doing and the good that you're able to do is incredibly important. And then, of course, finally, making sure that you're paying attention to your own mental health needs and seeking help, even though there is a stigma against it in the profession.
What do you think can be done here in this country to support our caregivers, and what role do you think faith can play in that?
Well, I think first of all, we already are beginning to make sure that we're seeing them as heroes and applauding the work they're doing and doing our best to support them emotionally on social media and in other ways. I think continuing to stay home so that we can make sure that we make their load a little bit lighter and can give them the opportunity that they need to take care of themselves. And I do think, of course, praying for them is incredibly important, and remembering that during this time, that if you are a healthcare worker, to remember to reach out for those spiritual resources. The fact is, spiritual tools of coping have been shown in study after study to help improve resilience and help people both resist depression and anxiety and bounce back more quickly from anxiety. So making sure to get that time in prayer, making sure to get that spiritual support from colleagues and from spiritual mentors is just incredibly important. So making sure to latch on to those resources that our faith can give to us.
Well, thank you so much for coming on today and talking about this very important subject. We really appreciate it. Dr. Gregory Popcak, thanks again for your insights.
A pleasure, Tracy. Thank you.